ఓకే. వాట్ ఎవర్ ద పోసాలజీ పార్ట్ ప్రాబ్లమ్స్ ఏవైతే ఉన్నాయో వాటికి సొల్యూషన్స్ అనేవి నేను మీకు షేర్ చేస్తాను. Immediately after completion of the class, I'll share you. You just refer it. And I want to give you one clarity. In your final exam, whatever the problems that are coming from posology, you just remember what is Dilling's formula, Young's formula. ఆ ఫార్ములాస్ గుర్తుపెట్టుకోండి అంతే. దట్ ఈస్ సఫిషియెంట్. సో ఫ్రమ్ పోసాలజీ పార్ట్ యూ కెన్ expect only the problems, direct problems వస్తాయి. If you know the formula, if the formula is in your mind, you can easily solve that problems. But proof spirit problems, you need to work out on it. ప్రూఫ్ స్పిరిట్ అంటే కొద్దిగా ఇప్పుడు యంగ్స్ డిల్లింగ్స్ అంటే మనం డైరెక్ట్ గా ఎస్ కీ మిస్టేక్స్ ఉన్నాయి. బట్ ప్రాబ్లమాటిక్ పార్ట్ మాత్రం నేను మీకు I'll tell you the formulas too. ప్రాబ్లమ్స్ మాత్రం నేను ఆల్రెడీ సాల్వ్ చేశాను. ఆ రిటర్న్ పార్ట్ మీకు ఫార్వర్డ్ చేస్తాను. But I can give you one suggestion regarding posology. You just memorize the formulas. That's it. Formulas మీకు గుర్తుంటే మీరు ఏదైనా చేయొచ్చు. అంటే కన్వర్షన్స్ అలా ఏమి ఇవ్వరు, డైరెక్ట్ గా ఇస్తారు. డోంట్ వరీ అబౌట్ posology ప్రాబ్లమ్స్. Okay. Without wasting time, let's go on to our today's paper discussion. Is my voice audible to you all? Yes. Okay. So coming on to our first question, what is the outermost layer of blood vessel wall is called as? First I'll tell you the answer, then I'll make you to write about each and every option. Yes, adventitia is your outermost layer, but note one point about each and every option. First adventitia. It is the outermost layer of blood vessel wall. It is the outermost layer of blood vessel wall. Then second point, it is connective tissue layer. It is connective tissue layer. That helps to anchor the blood vessel to the surrounding tissue. Even though you know the explanatory part, but you just note in your notes. It is a connective tissue layer that helps to anchor the blood vessel to the surrounding tissue. Then coming on to our second option, media. It is the middle layer of blood vessel wall. Contains smooth muscle cells and elastic fibers. Contains smooth muscle cells and elastic fibers. Coming on to function of this media layer. This layer is responsible for rule number 13. What you want to repeat? Which point you need the repetition? Media. This is the middle layer of blood vessel wall. Contains smooth muscle cells and elastic fibers. Coming on to function of media. This layer is responsible for regulating the diameter of blood vessel, which in turn controls the blood flow. I'll just repeat about media, then I'll move on to our next option. Media, it is a middle layer of blood vessel, contains smooth muscle cells and elastic fiber. Coming on to function of media, this layer is responsible for regulating the diameter of blood vessel, which in turn controls the blood flow. Then coming on to our third option. Intima. It is the innermost layer of blood vessel wall. Innermost layer of the blood vessel wall. Contains smooth muscle cells. Sorry. It is the innermost layer of blood vessel wall, which is in contact with blood flowing. Through the vessel. I'll repeat once again. Intima, it is the innermost layer of blood vessel wall, which is in contact with blood flowing through the vessel. Note down the second point. It contains single layer of endothelial cells. And it acts as a barrier between blood and the surrounding tissue. It acts as a barrier between blood and the surrounding tissues. 3 options note చేసుకున్నారా explanatory part? Even though you know, you just note it. Okay, inner layer, outer layer మీరు చెప్తున్నారు, but functions అయితే note చేసుకోండి. Then coming on to vasa vasorum. Last point about intima. It contains single layer of endothelial cells. Acts as a barrier between blood and the surrounding tissues. Coming on to fourth option, vasa vasorum. It is a small blood vessel. That supply the blood to the walls. Of large blood vessel. Vasa vasorum ante it is one kind of small blood vessel that will supply blood to the walls of large blood vessels. These vessels are found in adventitia and media layers. These vasa vasorum vessels are found in adventitia and media layers of blood vessel wall, and provides necessary nutrients and oxygen. To the cells in this layer. Whatever the cells which are present in your adventitia and media layer, to that cells this vasa vasorum will provide nutrients as well as oxygen. Note చేసుకున్నారా? Did you note what I told you? Yes. Okay. second question kuda, it is the explanatory part. Even second question is also explanatory part. Almost in today's question paper, anatomy related or pharmacology related or explanatory part undi. You note each and every point. Did you got what I told you? Even though you know these potentials, you note it. Then second question, the resting membrane potential of a neuron is. The resting membrane potential of a neuron is. First, I'll tell you the answer. Then I'll make you to write about explanatory part about each and every option. Okay? The answer is minus 70. The answer is minus 70 megavolts. Then coming on to second option, minus 50 megavolts ante enti. Already minus 70 they had given you. Note about minus 50. Minus 50 గురించి చెప్తున్నాను, నోట్ చేసుకోండి. Threshold potential that needs to be reached in order to produce action potential, in order to produce or generate action potential. If I'm going fast, please tell me in the chat box why, because it is explanatory part, it is very important. If I'm going fast, please mention in the chat box. I want everyone to note each and every point. Am I going fast? Yeah, okay. If I'm going fast, tell me openly why, because these are very important. That's the reason I'm asking you. Okay. My voice is breaking between. It is clear for all. Once clear it clear na voice ledante malli nenu log out ayi login aitanu, but ee paper matram it is very important. Yes, okay. Then third option, okay, minus 50 note చేసుకున్నారా? minus 50 గురించి note చేసుకున్నారా? I'll repeat once again. Minus 50 means it is threshold potential that needs to be reached in order to produce or generate the action potential. Oh, the same problem I'm facing. Then plus 30 megavolts. Peak membrane potential. It is a peak membrane potential. Plus 30 megavolts is a peak membrane potential. During the depolarization phase, it is a peak membrane potential. During the depolarization phase of an action potential. Plus 30 megavolts means it is a peak membrane potential during the depolarization phase of an action potential. Then coming on to 0 megavolts, it is a membrane potential. When neuron is undergoing an action potential. It is a membrane potential when neuron is undergoing an action potential. Then, coming on to third question, the part of brain responsible for regulating sleep and wakefulness. Ante hypothalamus. How can you, why hypothalamus only అని అడగట్లేరు ఏంటి? No one is asking why, ma'am, hypothalamus only. Do you know the reason? Yes, no, wait. Yes, pineal gland. Yes, pineal gland. 50% of your answer is correct. But in our hypothalamus, it contains suprachiasmatic nucleus. The suprachiasmatic nucleus will act as a biological clock. ఈ సూప్రాచియాస్మాటిక్ న్యూక్లియస్ వేక్ఫుల్నెస్ స్లీప్ మూమెంట్స్ ని రెగ్యులేట్ చేస్తుంది. అకార్డింగ్ టు యువర్ ఆప్షన్స్ hypothalamus is correct, but in this hypothalamus which part will regulate? If they'll ask you which part will regulate, means you have to answer suprachiasmatic nucleus. Suprachiasmatic nucleus. Even this pineal gland also secretes melatonin. And also this pineal gland also plays, ante it also will regulate sleep wake cycles. ఈ pineal gland suprachiasmatic nucleus both will play an important role in regulating the sleep and wakefulness. But ఈ pineal gland మొత్తం రెస్పాన్సిబిలిటీ అంతా pineal gland తీసుకుంటుందా sleep and wakefulness అంటే it is not correct. This pineal gland will play an important role in regulating sleep and wakefulness up to 50% only. But suprachiasmatic nucleus, without suprachiasmatic nucleus, we can't maintain our sleep and wakefulness. Suprachiasmatic nucleus plays crucial role for maintaining sleep and wakefulness. Did you got what I told you, Shahana? Yes. అంటే ఇలాంటి క్వశ్చన్స్ వచ్చినప్పుడు మీరు ఆప్షన్స్ కంపల్సరీ చూసుకోవాలి. వాడు హైపోథాలమస్ ఇచ్చాడా, పీనియల్ గ్లాండ్ ఇచ్చాడా, సూప్రాచియాస్మాటిక్ న్యూక్లియస్ ఇచ్చాడా, అలాంటివి మాత్రం చూసుకోవాలి. ఎస్. సో హైపోథాలమస్, పీనియల్ గ్లాండ్ బోత్ విల్ ప్లేస్ అన్ ఇంపార్టెంట్ రోల్. బట్ ఆప్షన్స్ లో మాత్రం hypothalamus first priority is given to the hypothalamus. Then second priority is given to the pineal gland. No, they won't give thalamus. Thalamus doesn't play any important role in sleep and wakefulness. Then coming on to fourth question. Fourth question, what is the license granted for wholesale of drugs? ఇక్కడ మీకు ఎడ్మింగిల్ యాప్ లో క్వశ్చన్ చేంజ్ చేశారు. They had changed the question. They had given you license granted for wholesale of homeopathic drugs. That is form number 20D. Homeopathic drugs ante form number 20D. In my written notes I had given you the form numbers. Tabular chart ichana? చూసారా ఎవరైనా టేబులర్ చార్ట్ ఫార్మ్స్ ది? Did anyone see? Yes, that tabular chart is more than enough. You memorize that, you by heart that is sufficient. I'll give you 110% assurance that tabular chart is more than enough. Then fifth question, what is the purpose of occupational therapy in outpatient care? Purpose of occupational therapy in outpatient care ante to help the patient to improve their ability to perform the activities of daily living. Then coming on to sixth question, what is the primary function of central nervous system? Primary function of central nervous system ante all. Yes, because of suprachiasmatic nucleus, your answer is hypothalamus. But మీరు ఒక క్వశ్చన్ అడగట్లేదు. You are not raising the question. మేడం pineal gland కూడా wakefulness లో ఇంపార్టెంట్ రోల్ ప్లే చేస్తుంది కదా అని చెప్పారు. You are not raising this question. Why? Extra. No, it is not form 25. It is 20D. Homeopathic drugs means it is 20D. They had given you the question license granted. Not, it is not application form. They had given you license granted. Pineal gland enduku correct answer kaadu ani adigatleru. Pineal gland Pineal gland, okay, it will regulate, but not completely. Suprachiasmatic nucleus లేనిది ఈ pineal gland regulate చేయలేదు sleep and wakefulness. That is the reason hypothalamus is your answer. Then coming on to 7th question. The refractory period of neuron refers to. The refractory period of neuron refers to the time it takes for neuron to recover from the action potential. I'll wait for 1 minute, but you note this point. Refractory period ante ento note cheskondi. You note this point. So, ఎవరి దగ్గరైనా ఇంటర్మీడియట్ జువాలజీ టెక్స్ట్ బుక్, సెకండ్ ఇయర్ జువాలజీ టెక్స్ట్ బుక్ ఉంటే వన్స్ యూ రెఫర్ దట్ జువాలజీ టెక్స్ట్ బుక్, దాంట్లో ఇప్పుడున్న మనకి ఉన్న షార్ట్ పీరియడ్ ఆఫ్ టైంలో ఈ రిఫ్రాక్టరీ పీరియడ్, న్యూరాన్ ట్రాన్స్మిటర్స్, వాటన్నిటికి ఈ ఇంటర్మీడియట్ జువాలజీ టెక్స్ట్ బుక్ ఈజ్ మోర్ దాన్ ఎనఫ్. ఇఫ్ యు ఆర్ హ్యావింగ్ ఇట్, యూ కెన్ రెఫర్. ఇఫ్ యు ఆర్ హ్యావింగ్ రాస్ అండ్ విల్సన్, ఇట్ ఈస్ ఆల్సో సఫిషియంట్. రాస్ అండ్ విల్సన్ లో ఎట్లా ఉంటుందంటే ఒక పాయింట్ కి ఇంకో పాయింట్ కి రిలేషన్ లేకుండా ఉంటుంది. దట్ ఈస్ ద రీజన్ వన్స్ యూ రెఫర్ ఇంటర్మీడియట్ జువాలజీ టెక్స్ట్ బుక్. Did you got what I told you? Then 8th question. The term atherosclerosis refers to. Atherosclerosis ante hardening of arteries. ఎవరి దగ్గర ఇంటర్మీడియట్ వాళ్ళు ఉంటే బారో చేసుకోండి, లేకపోతే రాస్ అండ్ విల్సన్ అయినా రెఫర్ చేయండి. If you don't have that, all means in Unacademy they had explained you clearly. Once you refer Unacademy classes in YouTube, her name is Priyanka Sachdev. Once you refer the classes of Priyanka Sachdev in Unacademy YouTube, even her classes are also sufficient now. Then ninth question. What is the formula of Clark's rule? Clark's rule formula note చేసుకోండి. No, ఒకసారి నోట్ చేసుకోండి. ఇక్కడ కేజీస్ లో ఇచ్చారు. It is not kgs. Once you note the Clark's formula, child weight in LBS by 150 LBS. ఒక నిన్నట్లాగా ఒక హాఫ్ పేజ్ ఈ పోసాలజీ ఫార్ములాస్ కే లీవ్ చేసుకోండి. ఎందుకంటే ఈరోజు పోసాలజీ రిలేటెడ్ చాలా క్వశ్చన్స్ వచ్చాయి. ఫార్ములాస్ కే ఒక హాఫ్ పేజ్ పెట్టుకోండి. చైల్డ్ వెయిట్ ఇన్ LBS by 150 LBS into adult dose. Option B is correct, but LBS లో కూడా నోట్ చేసుకోండి. into adult dose. Mostly in your final exam they'll ask you regarding LBS only. They won't focus much on kgs. That's the reason I had told you the formula in LBS. I think posology మీకు ఇంకా అవ్వలేదు కదా. We have left out with posology topic, no? అయిపోయిందా? Okay. Then the drug camphor is obtained from which plant? The drug camphor is obtained from Cinnamomum camphor. Then 11th, in what unit is the adult dose of a medication typically expressed when using Young's rule? Milligram per pound. Option C is your correct answer. Then 12th question, what is the formula for Dilling's rule in dosage calculations? Formula for Dilling's rule ante adult dose into age in years by 20. A కాదు, C is your correct answer. C is your correct answer. Then 12th question. Patient wait by no. Can you hear my voice? It is reading. That is the reason. No. Can you hear my voice? Okay. Dilling's formula ante none of the above, but note the Dilling's formula. Adult dose into age in years by 20. Age in years by 20. ఈ Dilling's formula 4 to 20 years of age group వాళ్ళకి యూజ్ చేస్తారు. Young's formula, it is in pounds. Young's formula, it is in pounds. Pounds లో మెజర్ చేస్తాం. Young's. No. Or else we can measure in mg kuda. We can measure in mg also. 12th none of the above, but Dilling's formula is adult dose into age in years by 20. Age in years by 20. మీకు ఇచ్చిన ఆప్షన్స్ ప్రకారం none of the above is your answer. But Dilling's formula is adult dose into age in years by 20. Then coming on to 13th question. Reservoir of urban rabies is. Reservoir of urban rabies is dogs. Then 14. What is the purpose of? Wait 1 second. Youngs అయితే mgs లో యూజ్ చేస్తాం. ఒకసారి ఈ ఫార్ములాస్ నోట్ చేసుకోండి. యంగ్స్, డిల్లింగ్స్, ఫ్రైడ్స్ రూల్. After the completion of your paper discussion, I'll give you the formulas for Young's, Dilling's, Fred's. Avanni unnai ante I won't give. If you don't have, I'll give you at the last. Then 14th. What is the purpose of Jyoti ma'am ichcharu kada? Okay. Then we'll stick on to only the paper discussion. Then what if you don't have, I'll give you. And if you have, then I'll leave that. Then 14th. What is the purpose of physical therapy in outpatient care? Physical therapy in outpatient care ante to help the patient to improve their physical function and mobility. Then 15th question. The part of brain responsible for language comprehension is. Language comprehension ante Wernicke's area. Yesterday I had explained about each and every option. Then 16th. What is the 14th? C is your answer. 14th C is your answer. Then 16th. Which of the following statement about gluconeogenesis is correct? Statement about gluconeogenesis. Pyruvate is first converted. No. Option C is correct. Glucose 6-phosphatase hydrolyzes glucose 6-phosphate to release glucose into blood. Then 17. The parasympathetic nervous system is responsible for. Parasympathetic nervous system. Rest and digest response and increase in heart rate also. It is responsible. B, D options are correct. Fight and flight is sympathetic nervous system. Fight and flight, it is related to sympathetic nervous system. 17th, what answer they had kept in your Edmingle, I don't know, but B and D both are correct. B and D both are correct. Then 18, what is the unit of measurement used for patient weight in Dilling's rule? Dilling's rule ante kilogram, kg. Then 19, what is the purpose of suspending agent in in suspensions? What is the purpose of suspending agent in suspensions ante to prevent the drug from settling to the bottom of container. Then 20, what is Young's rule used for? Young's rule is used for dosing the medications in children. And then 21, what is Clark's rule? How Clark's rule is different from Young's rule. Clark's rule take into account the child's surface area. This is the difference. Then 22, the cerebrospinal fluid. 22, the cerebrospinal fluid is produced by. Cerebrospinal fluid is produced by coracoid plexus. Coracoid plexus. Even how Clark's rule is different from Young's rule. Can you hear my voice? It is reading. I lost my connection. The left ventricle pumps blood to. The left ventricle pumps blood to your left atrium. Then 24, which of the following communicable disease is most commonly spread through sexual contact? Chlamydia. Twenty-three. 23. Left with left ventricle, it pumps the blood to body. Aorta. Left ventricle will pump your blood to aorta. It will pump oxygenated blood. లేదు లెఫ్ట్ వెంట్రికల్ పంప్ ఆక్సిజనేటెడ్ బ్లడ్ త్రూ యువర్ అయోటా, అయోటిక్ వాల్ నుండి అయోటాకి పంప్ చేస్తుంది. దెన్ ఇట్ విల్ గో టు యువర్ బాడీ. లెఫ్ట్ ఏట్రియం కి అయితే వెళ్ళదు. మీకు ఇచ్చిన ఆప్షన్స్ ప్రకారం నో లెఫ్ట్ వెంట్రికల్ విల్ పంప్ ఆక్సిజనేటెడ్ బ్లడ్ టు అయోటా, అండ్ ఈ అయోటా నుండి మనకి ఆక్సిజనేటెడ్ బ్లడ్ విల్ రీచ్ టు అవర్ బాడీ. 21. How Clark's formula is different from Young's formula? Clark's formula take into account child surface area, and Clark's formula is only accurate for X, less accurate patient. Used only specific medication differentiate. అసలు మనం సర్ఫేస్ ఏరియాని యూజ్ చేయం. క్లార్క్స్ రూల్ ఈస్ ఓన్లీ అక్యురేట్ ఫర్ చైల్డ్ ఓవర్ 6, less accurate than then Clark's rule is only used for specific dosage form. But అట్లా ఉండదు. డిఫరెన్స్ అంటే 21 అసలు సర్ఫేస్ ఏరియాని మనం అకౌంట్ లోకి తీసుకోము. క్లార్క్స్ అండ్ యంగ్స్. క్లార్క్స్ రూల్ ఈస్ ఓన్లీ అక్యురేట్ ఫర్ చైల్డ్ ఓవర్ ఏజ్ 6. అట్లా ఏం ఉండదు. క్లార్క్స్ రూల్ ఈస్ లెస్ అక్యురేట్ దెన్ యంగ్స్ రూల్. Clark's rule is only used for specific. C కూడా wrong, D wrong, even C wrong. Then option B would be correct. Differentiation అంటే B is correct. B is correct. సారీ, ఇక్కడ కరెంట్ పోతుంది అని నేను హరీబరీగా చెప్తున్నాను. బట్ ఆప్షన్ B is కరెక్ట్. ఎందుకంటే మనం సర్ఫేస్ ఏరియాని యూజ్ చేయలేము. లెస్ యాక్యురేట్ అని కూడా చెప్పలేము. క్లార్క్స్ రూల్ ఈజ్ ఓన్లీ ఫర్ స్పెసిఫిక్ మెడికేషన్ అన్నా కానీ చెప్పలేము. సో సారీ, ఏమైనా డౌట్స్ ఉంటే లాస్ట్ లో అడగండి మా. ఒకసారి చూద్దాము. పవర్ అయితే ఉంది కదా, చూద్దాం. ఎంతవరకు అయిపోతే అంతవరకే చెప్దాము. అప్పటివరకైతే చూద్దాం. 25th, which of the following communicable disease is caused by parasite? Communicable disease caused by parasite అంటే malaria. Then 26, which of the following is a risk factor for cardiovascular disease? Risk factor for cardiovascular disease అంటే all. Then 27, the blood-brain barrier is formed by. Blood-brain barrier is formed by capillary endothelial cells. Capillary endothelial cells. Then 28, Young's rule assumes that child have faster metabolism than adults. Child have slower metabolism than adults. Child have same metabolism than adults. Assume అంటే assumption కాబట్టి option A is correct. Then 29, the spinal cord is divided into how many regions? Spinal, cervical, thoracic, lumbar. And 30, what is the formula for calculating the child's dosage using Young's rule? Using Young's rule అంటే age of child, option A, age of child ఫార్ములా అయితే ఏజ్ ఆఫ్ చైల్డ్ బై ఏజ్ ఆఫ్ చైల్డ్ ప్లస్ 12. And 31 is Young's rule. Can you hear my voice? Actually, it is raining. I lost my connection. That is the reason.
నీ చార్జర్ అవసరం నా చార్జర్
Then 40 patient weight in pounds.
తినే ఇక వెళ్ళిపోతున్నాయి కదా.
Then 41. Which of the following statement is not true? Which of the following statement is not true? Ante HMP shunt doesn't generate. It will generate carbon dioxide. So option B is wrong. 31. Yeah. 31 is Young's rule accurate for all pediatric patients? No, it is not accurate. We can take only up to under 16. Under 6. Then 32 what is telemedication ante? Okay, what is telemedicine ante? Type of outpatient appointment that involves video conference with healthcare provider. And 33, which of the following immune system components would not recognize the macromolecule epitope? Antibody. And 34, what the part of brain responsible for processing visual information ante occipital. 35 ఇది నేను రిటర్న్ పార్ట్ మీకు షేర్ చేస్తాను. ఇట్ ఈస్ ప్రాబ్లం we can't explain now. Then 36, what is the desired dose of Dilling's rule? Formula, the minimum effective dose for the patient. And 37, which of the following conveys the longest lasting immunity to an infectious agent ante naturally acquired active immunity. And 38, the liquid part of brain is called as plasma. 39, the biological control for moist heat sterilization spores ante Bacillus stereothermophilus. Then 40, in Dilling's rule formula, what does the patient weight represent? It is represented in pounds. Then 41, which of the following statement is not true? HMP shunt does not generate carbon dioxide is not true. Then 42, diacetylmorphine is also known as diacetylmorphine is also known as heroin. Then 43, the ion responsible for depolarization of neuron during action potential is ante sodium. Then 44, disinfection means ante destruction of all pathogenic organisms. The sound of heartbeat is caused by opening and closing of heart valves. Then 46, the purpose of a blood test in outpatient care. The purpose of blood test in outpatient care ante to monitor the blood glucose level. To monitor the blood glucose level as well as to screen the disease or any condition. Both A and C are correct. Then 47, what is the purpose of using Dilling's rule in medication dosage calculation? To avoid the giving the patient too much medication which leads to harmful side effects is your answer. Then 48, which of the following is an example of plant-based antihypertensive agent? Plant-based antihypertensive agent ante garlic. Then 49, in Young's rule, what is the assumption about child's physiology compared to adult's physiology? Ante child's metabolism is faster. Then 50, which of the following is an example of plant-based wound healing agent? Plant-based wound healing agent ante aloe vera. Then 51, what is the product generated after completion of first phase? Ante all. Then 52, NDPS ante narcotic drugs and psychotropic substances. Consultative committee consists of maximum number of dash members. Enta mandi untaru? So 20 members. Then 53, the part of brain responsible for regulating the autonomic nervous system is Part of brain regulating the autonomic nervous system ante hypothalamus. Then 54, the action potential is initiated when the membrane potential reaches to threshold potential, at that time action potential is initiated. Then 55, the central nervous system consists of which of the following? It consists of brain and spinal cord. Then the innermost layer of blood vessel wall is called as. Innermost layer of blood vessel wall ante 56, intima. Then 57, the neurotransmitter responsible for muscle contraction is. 57, responsible for muscle contraction ante acetylcholine. Then 58, what type of reaction occurs in second phase? What type of reaction occurs in second phase ante non-oxidative reversible. Then 59, the protective membranes that surround the brain and spinal cord are called as meninges. Then 60, what is the formula for calculating the volume of pure alcohol in a given volume of proof spirit? Formula adigaru. 61, volume of proof spirit is equals to 60 అసలు నేను చెప్పలేదు. What is the medical term for stroke caused by a blood clot in the brain? By a blood clot in the brain ante ischemic stroke. And 61, formula idi, volume of pure alcohol is equals to percentage of alcohol into volume of proof spirit by 100. Stroke ante ischemic stroke. No, 60 answer B. Hemorrhagic stroke కాదు, ischemic stroke. Ischemia అంటే ఏంటి? Ischemic, not Then 62, what is the medical term for low blood pressure? Ante hypotension. Then 63, the part of neuron that receives signal from other neuron is. The part of neuron that receives signals from other neuron, it is dendrite. And 64, which of the following is an example of plant-based anti-diabetic drug? Gymnema sylvestre. Then blood film is required in malaria. Then sharp instruments may be sterilized with. Sharp instruments are sterilized with ivevi kaadu. They are sterilized by autoclaving, dry heat sterilization. Even radiation kuda cheyochu. ఈ రేడియేషన్ తో పాటు ఆటోక్లేవింగ్, డ్రై హీట్ స్టెరిలైజేషన్ కూడా యూజ్ చేయొచ్చు. రేడియేషన్ తో పాటు ఆటోక్లేవింగ్, డ్రై హీట్ స్టెరిలైజేషన్ కూడా యూజ్ చేయొచ్చు. ఈ స్టెరిలైజేషన్ ఒకసారి మీరు పియర్సన్ టెక్స్ట్ బుక్ లో దే గేవ్ యూ ఇన్ ద టేబులర్ కాలమ్. వన్స్ యూ మెమరైజ్ దట్ ఈస్ సఫిషియంట్. బ్లడ్ ఫిలిం అంటే మన దిల్ కలెక్ట్ ద బ్లడ్ అండ్ బ్లడ్ శాంపిల్స్ ని కలెక్ట్ చేసి స్లైడ్ లో పెడతారు, దాని బ్లడ్ ఫిలిం. Then 67, the brainstem consists of midbrain pons and medulla oblongata. Wait. Then 68, which of the following is not a type of cardiovascular disease? Asthma kaadu. Then 69, what is an example of medication that may be prescribed to an outpatient for chronic condition? Prescribed for outpatient for chronic condition ante insulin. Then 70, The part of brain responsible for coordinating voluntary movements is the part of brain responsible for coordinating voluntary movements ante cerebellum. And 71, which of the following is a psychiatric substance under Narcotic Drugs and Psychotropic Substance Act? 71 narcotic. Barbiturate is your answer. Why? Because we can give all this, but barbiturate ఇవ్వలేం. And 72, the drug quinine is obtained from which plant? The drug quinine is obtained from Cinchona officinalis. Then 73, the drug paclitaxel is obtained from which plant? Paclitaxel is obtained from Taxus brevifolia. Then 74, I'll give you the written part. It is a problem. Then 75, which of the following is not a way to prevent the spread of communicable disease? Not a way to prevent the spread of communicable disease ante sharing personal items with others. And 76, which of the following is a messenger mediated connection? I'll give you that problematic part, written part. నేను మీ క్లాస్ అవ్వగానే షేర్ చేస్తాను. We can't explain this. I'll share you. Then 76, which of the following is a messenger that mediates the connection between the innate and adaptive immune system ante cytokinins. Wait. 76, cytokinins. ఈ 77 కూడా ఇస్తాను. 78, the part of brain responsible for processing auditory information. Auditory information ante temporal lobe. Then 79, which of the following is a condition where the heart cannot pump enough blood to meet the body needs? To meet the body needs ante congestive heart failure. 80 కూడా నేను ఇస్తాను మీకు. Then 81, which of the following is a majority artery that supply blood to the arm? That supply blood to the arm ante subclavian artery. Subclavian artery. Then 82, which of the following is not a type of monophasic liquid dosage form? Tablet is not. Then 83, the oxygen carrying protein in red blood cells is called as hemoglobin. Hemoglobin. Not a type అని ఇచ్చారు. Not a type అంటే tablet. First read the question properly. Then 84, a freshly prepared ORS should not be used for more than. We can't use more than 24 hours. Type of monophasic liquid dosage form. Even emulsions, suspensions, these are biphasic. These are biphasic. అంటే ఇక్కడ not cut చేయాలి. Type of liquid dosage form అంటే solution would be correct. ఇవి biphasic. Emulsions, suspensions. They had given you question wrong. ఈరోజు చాలా key mistakes ఉన్నాయి. Then 85, the biological control for testing the dry heat efficacy are spores of non-toxigenic. Are spores of non-toxigenic ante Bacillus stereothermophilus. And 86, which of the following mediates an early response to viral infections by innate immune system? By innate immune system ante interference. Then 87, punishment for contravention in relation to ganja. 87, in ganja ante 2 years imprisonment and 10,000 fine. Then 88, the drug pilocarpus is obtained from which plant? Pilocarpus Laborandi. Then 89, the drug artemisinin is obtained from which plant? Artemisiana. Then Medical and Toilet Preparation Act. Medical and Toilet Preparation Act 1955. Then ఇది 91 నేను మీకు ఇస్తాను. Then blood is returned to the heart through. Blood is returned to the heart through veins. Then 93, which plant is a source of digitalis, a medication used to treat heart failure? A medication used to treat heart failure, foxglove. Then 94, the part of brain responsible for motor control is? The part of brain responsible for motor control and motor cortex. Then 95, oxaloacetate is reduced to malate by? Oxaloacetate is reduced to malate by malate dehydrogenase. And 96, the length of lag phase of growth can vary depending on all choices are correct. Then the sympathetic nervous system is responsible for? Sympathetic nervous system, fight and flight response. Then right ventricle pumps blood to? Right ventricle pumps blood to lungs. Young's formula is used for? Young's formula is used for to calculate the pediatric dose. Then 100, which of the following is not an example of solvent used in monophasic liquid dosage forms? Sodium chloride. Then which of the following is the pacemaker of heart ante S anode? Then 102, the peripheral nervous system consists of which of the following? Consists of which of the following ante sensory and motor neurons. 103 నేను మీకు ఇస్తాను. Then what is the Dilling's rule in dosage calculation? Dilling's rule in dosage calculation ante mathematical formula used to calculate the correct dosage of the medication based on patient weight. Then 105.
లక్షలు తింటున్నా.
And 105, adaptive immunity, adaptive immune system response typically takes how long? It takes days. Then 104, a mathematical formula used to calculate the correct dosage form of the medication based on patient's weight. 106. 106, what is the purpose of monophasic liquid dosage form? Purpose of monophasic to increase the surface area of target, to increase the bioavailability of the drug, to provide the sustained release of the drug, to deliver the bioavailability of the drug. 106, none of the above would be your answer. These all are not taken into consideration. Bioavailability to increase the Sustained release of sugar. What is the purpose of monophasic liquid dosage form అంటే ఇలా రావద్దు. బయో అవైలబిలిటీ వి కాన్ టేక్ ఇన్ టు కన్సిడరేషన్. ఎందుకంటే మోనోఫేజిక్ లిక్విడ్ డోసేజ్ ఫామ్ ఎందుకు ఇస్తాము? చిల్డ్రన్స్ ఒకవేళ టాబ్లెట్స్ అవి వేసుకోలేకపోతే అప్పుడు ఇవ్వచ్చు. కానీ బయో అవైలబిలిటీ అంటే ఈవెన్ టాబ్లెట్స్ కూడా బయో అవైలబిలిటీ ఇంక్రీజ్ అవుతుంది. దిస్ ఇస్ నాట్ ద రైట్ రీజన్. Your option should be none of the above. Surface area కూడా no, this is not the correct reason. ఇక్కడ పర్పస్ మనం ఎందుకు మోనోఫేజిక్ లిక్విడ్ డోసేజ్ ఫామ్ ని యూజ్ చేస్తున్నాం అనేసి అడిగారు. వై? బికాస్ చిల్డ్రన్స్ ఉంటారు, దే కాంట్ టేక్ నో. Surface area is also not taken into consideration. Your answer should be none of the above. Then 107, which of the following is true of monophasic liquid dosage form? True of monophasic liquid dosage form ante they are less stable than solid dosage form. They are easier to formulate. Even this is also correct. Then 108, what is the biggest limitation of Young's rule? Biggest limitation of Young's rule ante it is not accurate for all patients. Then 109, the heart is located in. The heart is located in your thoracic cavity. Epistomy best done. Epistomy best done mediolateral. Then the drug colchicine is obtained from which plant? Colchica maternale. Then which of the following is true about emulsions? Which of the following is true about emulsions ante they contain dispersed phase and continuous phase. And 113, what is the definition of proof spirit? Definition of proof spirit ante a spirit with an alcohol content 57.1. Then 114, how is Dilling's rule used in medication dosage calculation? To calculate the correct dosage form of medicines based on the patient weight. 115, which of the following is not a characteristic of monophasic liquid dosage form? Not a characteristic of liquid dosage form under two phase. To calculate the dosage form. And 116, what is a medical term for irregular heartbeat? Medical term for irregular heartbeat ante arrhythmia. Then 117, the part of brain responsible for emotion and memory. The part of brain responsible for emotion and memory ante hippocampus. Then 118, in what healthcare settings is Dilling's rule commonly used? Healthcare system Dilling's rule commonly used ante all the above. All the above would be correct answer. Hospitals and clinics, nursing homes, home care. No, wait. Hospitals and clinics would be correct answer. And even nursing home. Can you hear my voice? Actually, I lost my connection. Okay. 121, the part of brain responsible for processing sensory information is they are used for water insoluble drug. It is not the characteristic. Then 122 chemically cocaine is methyl ester of benzyl adenine. Then 123, what is the most common type of outpatient appointment? Most common type of outpatient appointment ante follow-up appointment with primary care physician. Then 124, the average adult has approximately how many liters of blood? Adult, how many liters of blood? Ante 4 to 5 liters. 4 to 5 liters. Can you hear my voice? Then 125, the part of brain responsible for regulating body temperature and hunger. Responsible for maintaining body temperature and hunger ante hypothalamus. Then 126, which of the following is a communicable disease that affects the respiratory system? That affects the respiratory system ante influenza. Then 127, what is the difference between solution and suspension? Solution has only one phase, suspension has two phases. This is your correct answer. 128 నేను మీకు పంపిస్తాను. 129 కూడా సెండ్ చేస్తాను. Then 130, what is the recommended method for calculating the pediatric dose? Recommended method for calculating the pediatric dose. ఎందుకు యంగ్స్ యూజ్ చేయొచ్చు, అన్ని యూజ్ చేయొచ్చు కదా. All should be your answer. Then 131, what is the major limitation of Young's rule? Limitation ante it does not take into account into child age is your limitation. 132 కూడా నేను మీకు సెండ్ చేస్తాను. I'll send you the solution for 132 also. Then 133, what is the risk of not using Dilling's rule in medication dosage calculation? In medication dosage calculation ante the patient may receive too much medication which can lead to harmful side effects. Weight, sorry, 131 it is weight. Young's formula limitation. We can take option A is correct. Option A is correct, 131. Then 134, which plant is the source of aspirin, a common painkiller? Willow tree. Then 135, which of the following is responsible for pumping blood to the rest of the body? Pumping blood to the rest of the body ante iota. Then 136, which of the following is an example of syrup? Milk of magnesia. And 137, the basic functional unit of nervous system. Basic functional unit of nervous system ante it is neuron. Then 138, what is the main purpose of outpatients in medical chart? Purpose of outpatients in medical chart ante to document the patient's medical history and current condition. Then 139, what is the purpose of two immiscible liquids? Then 140, which of the following is an example of plant-based expectorant? Plant-based expectorant ante licorice. Then 141, blood pressure is measured in millimeters of mercury. Can you hear my voice? Then 142. What is the age range for which Young's rule is considered most accurate? Young's rule is considered most accurate ante option C. 6 to 12 years age. 143. What is the advantage of using Clark's rule over Young's rule? Clark's rule is more accurate. This is the reason. Clark's rule is easier to use. Accurate would be correct answer. Easier to use adi kaadu. Option A is correct. Then 144, according to Young's rule, how the pediatric dose is calculated? According to Young's rule, how the pediatric dose is calculated ante child age multiplied by adult dose. Wait. Child age multiplied by adult dose. B would be correct. Then 145, the drug artemisinin is obtained from artemisiana. Then 146, what is a referral? Referral ante a recommendation from a healthcare provider for a patient to see the specialist. Then 147, which of the following is not a symptom of communicable disease? Not a symptom of communicable disease ante none of the above would be answered. Then 148, the process of blood clotting is called as? The process of blood clotting is called as hemostasis. Then 149, carriers are common in typhoid. And then 150, which plant is a source of morphine, a powerful painkiller? Source of morphine ante opium poppy. Opium poppy. So with this, your paper discussion had completed. Problematic part మీకు షేర్ చేస్తాను. ఆల్రెడీ నేను సాల్వ్ చేశాను. ఐ షేర్ దట్ టు యూ. సారీ, ఈరోజు చాలా కనెక్షన్ అనేది చాలా మిస్ అయింది. ఐఎమ్ రియల్లీ సారీ ఫర్ దట్. ఇట్ ఈస్ రైనింగ్. 50.104. One not 4, answer C is correct. 99. Young's rule to calculate the pediatric dose. 123. యాక్చువల్ అది ఆర్మ్ కి బ్రేక్షియల్ ఆర్టరీ అనేది బ్లడ్ ని సప్లై చేస్తుంది. 117 టు ద ఫుల్ కన్ఫ్యూజన్. హిప్పోకాంపస్ 117. హిప్పోకాంపసే కదా. I kept hippocampus only, no? I kept hippocampus only. Inka? If you don't have any doubts, I'll leave the meeting. C is your correct answer. 75, wait. 72, 80, 75, 80. 75 option D is correct. 82 B C D. నాట్ ఏ ఇక్కడ నాట్ కట్ చేస్తే ఆప్షన్ చేయలే కాబట్టి మిల్క్ ఆఫ్ మ్యాగ్నీషియా. ఇంకా ఇంకా ఏమైనా డౌట్స్ ఉన్నాయా? అండ్ యువర్ క్లాస్ వుడ్ బి జనరల్ స్టడీస్ పేపర్ డిస్కషన్ కాలేదు కదా? యూ హ్యావ్ యువర్ జనరల్ స్టడీస్ పేపర్ డిస్కషన్ టుమారో 5 o'clock. You have your paper discussion tomorrow 5 o'clock.